Hi, I am Dr. Corinne Wrightens, and I am a family medicine physician who's been practicing with Mosaic Life Care for the past 12 years. Being a family medicine physician, I see a variety of ages in the clinic, and recently have had a lot of children in for their well checks and annual exams. And during that time, a lot of the children, as well as the parents, have expressed some concern regarding the return to school and what that means for their families. I am a mother of a 13-year-old daughter, and I also have had concerns when thinking about her returning to school. So today we thought we would talk about some of the top 3 questions that I've been seeing in the office setting. One of those questions is, what is going to happen if a child tests positive in my kid's class? And that is a valid concern that everybody should have. But please know that there are processes in place that are going to help you figure out what to do if that happens. So our schools and health departments are going to be in contact with you if there is a child that tests positive. They will let you know what you need to do from there. And in the majority of cases, if a child does test positive in your kid's class, your child will be asked to be put on a 14-day quarantine. So a quarantine is when we are asking you to stay at home and limit contact with other people. And what determines if your child has to be at home is if a close contact occurred. So the CDC currently defines a close contact as being within 6 feet of a person who tests positive for COVID-19 for more than 15 minutes, and that is with or without a mask in place. So for the majority of students in the classroom setting, if one kid tests positive, then likely they will be asked to quarantine for those 14 days. The goal behind the quarantine is to monitor your child for symptoms and to limit contact so they are not spreading it to other people, even though they may have the disease and not have symptoms. So as a parent, during those 14 days, you want to watch the child, just frequently ask them if they're having any illness-related symptoms, and if so, you would contact your medical provider, tell them that you've had exposure to a person with COVID-19 that was confirmed through the school district and health department, and that they are currently having symptoms. And most likely your medical provider is going to want to have a virtual visit with you, talk about those symptoms, and then get the child tested for COVID-19. So that brings up another question that I frequently had: who should get tested for COVID-19? COVID-19 testing is currently recommended for anybody who has symptoms, and those symptoms would include a fever, which is defined as a temperature of 100.4 or higher, runny nose, congestion, a dry cough, difficulty breathing, vomiting, diarrhea, a change in taste or smell. So if any of that happens and you've had exposure, then your medical provider will likely do a COVID-19 nasal swab. We do have some suggestions that we should do a test if you have just had exposure, but there is some question as to when that should happen time-wise. Should it be a few days after exposure? And it really comes down to that testing is more to help identify potential positive cases in people that aren't having symptoms so that we can limit the spread of disease. So that is a decision that would be made between you, the medical provider, and the health department. So the third question that I am getting from parents is the general question of, what can I do to keep my child safe and healthy during the school year? So some of this comes down to the basics. We want you to stick to a routine, and this includes even if they're starting to do virtual education. So we still want the same wake time, the same sleep time, definitely getting good nutrition in. And that goes back to what many of your kids have heard about at the 4th grade challenge, which includes the 1, 2, 3, 4, 5 FANTASTIC. So we want them getting 5 servings of fruits and vegetables per day, 4 glasses of water per day, trying to avoid all those sugary beverages, getting in their 3 dairy products per day, limiting their screen time to 2 hours per day, which is going to be difficult in this virtual learning environment. So letting them know that schoolwork doesn't count towards those 2 hours, but you definitely want to limit the screen time otherwise. Get them out that they can do some physical activity, which we want an hour of per day, do some reading, do some board games. We also want you to limit how much they're hearing about COVID-19 on the news. So if you guys are doing some family time, limit that news in the background where they're hearing things. You've got to keep that positive attitude and talk to the kids about how change is going to occur this school year. They are going to have to learn to be flexible, fluid with all of these changes happening. There are going to be times they're in school, time that they're out of school, and how you approach your attitude with those changes is going to make a difference on how the kids respond. Some other advice to think about is encouraging your kids to wear masks whenever they cannot physically distance. And that may be hard when they're in the actual classroom, which is why the St. Joe School District has pushed for wearing masks throughout the day. There will be times when they can physically distance, and then it would be okay to lower those masks down. But otherwise, if they're within 6 foot of other people, they should keep their mask on. There are times that it needs to come off, such as when they're eating, if they're doing vigorous physical activity with PE, they would want to remove those masks. It's also important that you allow your kids time to get used to wearing the mask. So even if they're putting it on for 15 minutes several times during the day, they'll start to build up their tolerance to wearing it. We want your children wearing either a cloth mask or one of the medical grade masks that's available. The gaiters are sometimes used, but just know they're not as effective, and it would be better to have your child get used to the cloth mask for more protection. Parents, please understand that there are many adults working behind the scenes to make sure that your children are safe and healthy this school year. It has been my pleasure to share this information with you today. Please take care.